Hello and welcome to another edition of For the Record. My guest, Lisa Tomaso. She's here to talk about Recovery Works Rhode Island. It is her first time on the show. I welcome you to the show.
Thank you.
Tell me about Recovery Works Rhode Island. What is it?
Well, Recovery Works Rhode Island is a coalition, a broad-based coalition of professional organizations, businesses, and community members who have come together with a single purpose of envisioning a state that has lifetime access to recovery supports for every individual who needs it.
It's interesting. People have heard about different recovery organizations, agencies, but you don't really hear about sort of a coalition where a bunch of them come together. How did that come about?
So the history is that the coalition the initiative for the coalition began approximately a year ago. It was a conversation that was happening. I think, yourself or anybody that's out in the viewing public, they are very familiar with the stories that they read in the newspaper and are hearing on the news about our public health crisis that we're facing right now with addiction. What was different that we discovered within the last 5 years or so is the face. Who is being affected by addiction and where is it really happening?
People might have a sort of an idea in their mind who that person is, but they might be surprised at how many people and who their neighbor, their coworker, or anybody that you might not even think could be addicted.
Exactly. And addiction is not new. Addiction has been around for a very long time. But unfortunately, right now, in Rhode Island, as well as in many other states and across the country, we are facing a dramatic spike in overdose deaths related to opioids. And that has put a spotlight on the issue of addiction and, of course, recovery.
And that spotlight, it's good that the word is getting out about it, but what do? They've decided that a coalition getting together, exchanging resources and ideas is just one way to help as many people as possible, right?
So the idea behind the coalition is for a very long time we have had conversations about addiction, and those conversations took place within the behavioral health community. So that means mental health providers as well as people who are treating individuals with substance use disorder. But unfortunately, because of the stigma that's associated with mental health and substance use disorder, that's where the conversation ended. So when the face changed of who we were seeing on the news, it presented an opportunity that we could say, who's not at the table having the conversation with us? Who are the people who are being brought into the emergency rooms? And what we discovered is that they're people like myself and you. They are professional people. They are educated. They are our children. They're our neighbors. There's nothing different about them than
right.
us.
It's not some homeless person. It's not someone who's been habitually addicted their whole life. It's just like you said, it is those people, but it's also your coworker, your next door neighbor, your people who are professionals and people who you might not think can have these kinds of problems.
Exactly. So being able to open the conversation to the place where people are is at work. And I think that ultimately, and we believe at Recovery Works, that yes, recovery does work, but people who are in recovery or in need of recovery services are also working.
You used earlier the word crisis. Get more specific about where we are. Let's talk about Rhode Island first. Like, how bad is it?
It's pretty bad in Rhode Island. 92,000 people in the state of Rhode Island are battling with a substance use disorder. That's for individuals that are 18 and over. So that means that that's more than 10% of the population of Rhode Island.
Yeah. Rhode Island may be small, but that 10% is a lot for Rhode Island.
It is, and it is above the national average. We have 1 in 4 individuals who are using a mood-altering drug on a daily basis. That's the second highest in the nation. We have the highest rate of marijuana utilization, and we do not have legalized marijuana in Rhode Island.
Right, because that's big in the news now. The medicinal marijuana.
We do have medicinal marijuana in Rhode Island, but it's not legalized in the way that is
for recreational purposes.
For recreational purposes, like Colorado and Oregon.
Right. But this is a situation that exists. How are you compared to your neighbors, Connecticut, Massachusetts, New York, et cetera? Roughly in the same category as far as statistically?
We are all struggling.
Yeah.
We are. We're all struggling. Our neighboring Massachusetts is struggling. New York is struggling. Vermont, for Vermont, we know that it's such an issue that the governor made his State of the State address solely about the issue of addiction and recovery. So you know that this is a serious issue when it's being addressed in that way. And we're actually very grateful that our public leaders are taking that on and that they themselves are no longer afraid to be able to speak out about it.
It's good that they're able to take it on and speak about it. When you get into like state budgets and things, how are you able to survive, budget cuts, and there's always issues regarding money, so that always is an issue. Do you have any idea on that?
That it currently is being paid for through a grant that we have received from the Rhode Island Foundation. They are supporting us with a strategic grant so that we can implement some of our work and try and make a difference in this health crisis. So our objectives in that are that we would reduce the stigma associated with substance use disorders, as well as increase the awareness of substance use disorders to allow people to understand that a substance use disorder, addiction, is a disease. It is a chronic disease of the brain. And it is important for people to be able to understand that so that we can then improve access to recovery supports and then ultimately improve the health of our workforce, which for the members of our coalition is extremely important because, again, no secret to many folks, whether you live in Rhode Island or outside, but the Rhode Island economy has struggled for a very long time. We have wonderful leadership in our state that has focused themselves on jobs in the economy, and we're grateful for that. But one of the issues that are associated with jobs in the economy is the behavioral health of its workforce. And this is an opportunity with Recovery Works RI to address those issues. So we do go out and educate employers and professional organizations about exactly what that impact is. And that's part of our work also associated with the stigma, because it's about reframing the conversation so that people can continue to see individuals and addiction for the people that it represents.
When you say stigma, are we in a situation where pride is an issue? It's one of these things where a lot of times for an individual, in order to get help, they have to kind of, take the first step, so to speak. But people have might not necessarily, admit they have a problem or be willing to take the first step and just get themselves help. And if you have too much pride, because it's a stigma, a lot of people might not consider it serious enough where you should be, getting help for it. You know what I mean?
Stigma is a huge barrier to seeking treatment. And there are lots of kinds of stigma. You're talking about one kind.
Yeah.
There is stigma from individuals, that an individual believes false things about another person who has an addiction. Like, if you have an addiction, it's because you're lazy and weak-minded.
Right.
You're faking it. You could actually, if you were strong enough, you would be able to get over it. That is not the case. That is a myth, and that is why that is a stigma.
Yeah, and it's also something that you have to fight to try to get the word out about.
Exactly, and there are institutional stigmas that are based in public policy and organizational policies that treat people who have an addiction differently than people who do not, or differently than people who are struggling with other chronic diseases, such as cancer or diabetes or asthma. Policy issues in that sense. And then, of course, there's also the self-stigma, where society has told you long enough that you're a bad person, and you actually believe that. You believe that you're the reason you're what's wrong with you. And to that, I just have to say, I can't imagine that we would ever tell a person who is in recovery from cancer that
You're a bad person.
when it comes back, when they relapse, that somehow it was their fault. But we do that all the time.
People actually believe that?
We do that all the time with addiction. Not simply because we don't understand that it is a chronic disease of the brain. It's not their choice. I can assure you that there isn't one person out there who is addicted to anything, whether it's alcohol or an illicit drug or prescription painkillers, that's going to tell you, I'm choosing to do this.
And we all, we can sit here and talk about this, and everybody is either knows somebody, has somebody in the family, or maybe they themselves know somebody who is either addicted or has something going on in their life where some kind of help is needed in this regard. So it's not just the individuals themselves. Maybe if you want to talk about family being involved and what they have to go through, or close friends.
Well, recovery support services are needed for everyone.
Yeah.
And certainly the families who are struggling with family members and even close friends who have an addiction, who are struggling themselves with a substance use disorder, perhaps even a mental health disorder. It's very challenging for them, and they certainly do also need to have access to recovery supports.
And those services are available.
Well, yes, they are, and I will say that there is a growing need. As we said, we see the expansion of this public health crisis, and it has given us an opportunity. And I think I just want to take a moment to just remind folks, yourself, that we are amidst an opioid crisis, but addiction is everywhere, and that is not the only type of addiction that individuals struggle with. Alcohol is still number one on that list. This has just simply given us an opportunity to, like I said earlier, shine a light on it and raise the level of public awareness. And to not take advantage of this crisis in that way would really be to the disadvantage of the millions of people in America who struggle with substance use disorders that are not related to heroin or opioids.
That's very true. And it's also a good opportunity for us to take a break now, because we do have so much more to get to. Why don't you give out a website for people to go and learn more, and then we'll come back.
So the website for Recovery Works Rhode Island is www.recoveryworksri.org.
All right. Lisa Tomaso from Recovery Works Rhode Island. We do have a lot more to get to, so we'll take a short break and come right back. I'm Sean Murphy. This is For the Record. Stay with us. Welcome back to For the Record. I'm Sean Murphy. My guest is Lisa Tomaso. She is from Recovery Works Rhode Island. We went to the break having you give out the website. What's on the website for people to see?
Oh, you can find out information about the coalition. There are much needed facts and truths about addiction in the workplace in particular. And also there's an opportunity, if anyone would choose, to sign on to our pledge.
Do you need volunteers or anything like that? Any way for people to help out?
Well, actually, the way that we get our volunteers, and we had spoke about this a little bit earlier, that the coalition, becoming a member or a partner in the coalition is free. So we are the best deal in town because we are a good cause working towards a great effort in improving the health of the Rhode Island workforce. But our strength is within the volunteers that we have within the coalition, coming from the organizations that partner with us. And that is it's a pretty deep list. We have approximately 40 partners currently. They include the Rhode Island Manufacturers Association, the Greater Providence Chamber of Commerce, the Rhode Island Builders and the Painters. We have the Providence Center, also Gateway Health. Lots of organizations and groups of people who represent a wide spectrum within the issue. And so we have professional organizations like the Rhode Island State Nurses Association and the Rhode Island Academy of Physicians Assistants, but then we also have the Goodwill Industries, who do a lot of work facilitating and helping with the populations that we deal with.
So a very broad range of organizations are involved.
It is.
You might think of something that's needed, and you're like, wow, this is very helpful. You might not think of it at the time, but there's a use for everybody who's involved in the coalition, isn't there?
Exactly. And so the coalition functions in two ways. First and foremost, we advocate for public policies that near us to that vision of recovery support access for a lifetime for anyone who needs it in Rhode Island. But second, it's also about that public awareness and reducing the stigma. And that happens within the coalition itself, not just in that outward movement of the Recovery Works label. So I'll use as an example. If an organization has background in primary health care, but very little knowledge in behavioral health, we will take members who are represented from a professional organization in behavioral health, and they'll do a professional development, hour-long or 40-minute, whatever they have for that month, professional development opportunity, and give them some information so that they take away a little bit more knowledge and insight into behavioral health. Because again, a lot of this work that we're doing also is on a backdrop of the Affordable Care Act, as well as an integration of healthcare. And so that integration of healthcare really is about treating the whole person. And certainly mental health and substance use disorders are part of that whole person.
Whenever you use the term mental health, it's such a broad umbrella that things can be under it. And again, that's another one of those areas where there certainly is a stigma attached, where some people might not even think that it's a real problem, you know?
There are, but I was actually last night, the state of Rhode Island is just finishing up an overdose prevention and intervention task force that was begun by the governor almost immediately after she took office in January. And last night we had our second and final community panel, and it was about stigma. And there was a researcher who came in from Johns Hopkins University. Her name is Colleen Barry. They have done some really in-depth studies into stigma, and what they've actually discovered is that as much stigma as we believe exists for mental health, it's nearly twice that for individuals with a substance use disorder.
No kidding.
I was flawed.
Yeah.
I was
I'm so
personally
surprised
flawed.
by that.
I thought it would be about the same,
At
in
least,
the same
yeah.
range. It was, in many cases, double the stigma, which really, from my position sitting in the audience, really kind of motivated me to be excited to be here today so that we could share our message, but really to get out there and work harder, because I know that there's a whole lot of work that needs to be done.
It sounds like there's a lot of misconceptions, not just in that category, but overall.
There are a lot of misconceptions about the individuals, and a lack of understanding about what addiction really is.
When there are people watching the show, either they themselves or somebody they know needs help, they need to get into recovery, but one of the first questions they may ask themselves is, how do I pay for this? Is insurance covering these services that I need? So let's talk about insurance a little bit.
Okay, so insurance varies from state to state. It also varies from plan to plan. It is extremely important for individuals and families to know what is covered under their policy. It's also very important, given the Affordable Care Act, that employers know what they are offering to their employees for coverage, because the type of healthcare coverage that they have access to reflects directly on their bottom line. In the state of Rhode Island, we do have I'm sorry, I want to back up a little bit. Treatment is covered. Some treatment is covered, not all treatment. And in Rhode Island, we do have 2 commercial carriers who are currently covering recovery support services. We are very excited about that, but that's only 2 carriers. Recovery support services are not covered by Medicaid, Medicare, or TRICARE, which is the insurance for veterans.
Yeah.
This is a serious problem.
Yes.
In addition to that, I will just take it one step farther and say that Medicare does not cover treatment either. So if you are an individual with Medicare, which would be an elderly individual, and you need addiction treatment, we need to find you another way to pay for that.
That's a big issue.
And that is a big issue. And in particular for our elderly population, we know that there are many folks out there who have had medical complications and for a very long extended period of time have been taking particular types of medication without question. And one thing leads to another, and sometimes they don't even realize that they have an addiction until someone says, oh yeah, no, we're not going to prescribe you that anymore, and then that's when it becomes a problem.
I'm sure that somebody somewhere is lobbying on behalf to get Medicare included in this as far as being covered. It seems like it's an important issue that someone should be advocating on behalf of the elderly.
It is an important issue for the elderly, and in the same way that the coverage for Medicaid and TRICARE is also important for
Absolutely.
recovery support services. We are doing a whole lot better than we were in the past, and that's thanks to the Parity Act, which was passed several years ago at the national level. But there are still problems with the implementation and being able to monitor where there isn't, where parity does not exist. But many states, including Rhode Island, is doing a good job of trying to keep track of that to make sure that if it's covered, so with the Parity Act, what it means is that if something is covered for primary care, if it's the same type of activity, that it would also be covered for mental health or substance use disorder.
Are we moving in the right direction as far as more and more being covered by insurance, or
We
in some
are.
way having it be
We
financed?
are. I think that we are. You know, we have ongoing conversations, and in Rhode Island in particular, we just went through a round of reinventing Medicaid. So I think that, again, going back to the Affordable Care Act, forcing the question about health insurance, whether we like it or we don't like
We
it.
could do a whole show on that, by the way.
You could, but it opens up an opportunity, aside from the issues that exist and the political ideological differences that exist. It opens up doors for many other questions that are important to public health, and this is one of them. And so we're able to now have questions about what types of services are covered for wellness, for our workforce, for our families, for our communities.
Absolutely. This is a perfect opportunity to take one more break, so we will. I'm Sean Murphy. This is For the Record. We will be right back. Stay there. Welcome back to For the Record. I'm Sean Murphy. I'm here with Lisa Tomaso of Recovery Works Rhode Island. Before we wrap up the show, I just wanted to have you get in a little bit to the state of the recovery services that are available. Talk about that a little bit.
So recovery support services in Rhode Island are better than they are in some places else in the country. We currently are utilizing recovery coaches. We have approximately 85. They are certified by the state. They go through a 35-hour training and then have 500 hours of
Sort of in
supervised
the field? Okay.
in the field experience, and in order to become a fully certified peer recovery specialist, recovery coach. We also have recovery community centers in Rhode Island. We have 2 brick and mortar facilities, one in the urban core in Pawtucket, Rhode Island, and the other in the suburbs in Warwick. That's a partnership with the Kent County YMCA. It's on their campus, so it's a great opportunity to promote total wellness, individual wellness, both physical as well as the behavioral health. We also provide recovery support services in the Rhode Island Department of Corrections. We run programs for recovery in all of the facilities at the Department of Corrections. We also have what we call a pop-up recovery center that is in one of our health equity zones that's located in one of our urban centers in West Warwick, Rhode Island as well.
There's a lot of opportunities and a lot of locations that people can go and utilize the services.
There are, but there really aren't enough. I just have to say that what we're seeing is that individuals who are being affected by this crisis that we find ourselves in today are living in the more rural suburban areas in our state. And even though I know Rhode Island seems like such a small state and that seemed like a whole lot of offering, we really need to be able to expand those recovery support services so that it can match the needs of the individuals and the community that is there. It may not look the same from Providence in the center of city out to the farms in South Kingstown or West Kingstown. So what they need may be different, and it's extremely important that we consider it to be an individualized plan, that when we talk about recovery, that it is individual to each person and to each family.
We are out of time, unfortunately, so we're going to put the graphic for the website up on the screen one more time and just say thank you for educating us. We learned a lot today, and thank you for being on the show. You were great.
Well, thank you so much. I'm happy to have this opportunity.
Lisa Tomaso of Recovery Works, Rhode Island. Pleasure having you on the show. You can see the show, by the way, on our YouTube site. Till next time, I'm Sean Murphy. Take care.